A 22-year-old man with sickle cell disease, headache, and difficulty speaking. Presentation of case: A 22-year-old man was admitted to a Massachusetts hospital because of the acute onset of headache and difficulty speaking. The patient had been well until a diffuse headache developed. The pain gradually increased in severity until he rated at 10 on a scale of 0 to 10. Treatment: He took ibuprofen and the headache improved but did not resolve. Later that day, the patient smoked marijuana and was noted to have heavy breathing and unintelligible speech. On arrival to the hospital, he felt confused and had difficulty thinking of and saying words. He rated the headache at 3 out of 10. Clinical history: He had sickle cell anemia. It was associated with infrequent crises. His most recent blood transfusion had occurred 22 months before this evaluation. He had been hospitalized for pain crisis and for the acute chest syndrome. Evaluation at another hospital had revealed multiple intracranial aneurysms. His medications include ibuprofen and folic acid. Sickle cell disease, described as a group of inherited red blood cell disorders. People with SCD have abnormal hemoglobin called hemoglobin S or sickle hemoglobin. When a person has two hemoglobin S genes, hemoglobin SS, the disease is called sickle cell anemia. Sickle hemoglobin is not like normal hemoglobin. It can form stiff rods within the red cell, changing it into a crescent or sickle shape. Sickle-shaped cells are not flexible and can stick to vessel walls, causing a blockage that slows or stops the flow of blood. Most children with sickle cell disease are pain-free between painful crises, but adolescents and adults may also suffer with chronic ongoing pain. Sickle cells can change shape easily, so they tend to burst apart or hemolyze. The body is always making new red blood cells to replace the old cells. However, in sickle cell disease, the body may have trouble keeping up with how fast the cells are being destroyed. Because of this, the number of red blood cells is usually lower than normal. Conclusion: Sickle cell disease is a lifelong illness. The severity of the disease varies widely from person to person. At the present time, there is only one cure for sickle cell disease. Unfortunately, most people with sickle cell disease are either too old for a transplant or don't have a relative who is good enough genetic match for them to act as a donor.